I'm here today to be part of the big celebration of the official launch of the Teenage and Young Adult Service in Northern Ireland. Cancer services in Northern Ireland for teenagers have been really very patchy, apart from the main clinical centre in Belfast. So today we have our charity Cancer Fund for Children have met with other charities, we've collaborated, we've funded, and we're now actually launching a brand new service which will be rolled out throughout all of Northern Ireland, which will greatly benefit teenagers and young adults.
I was given the honour to compare the event today, which is launching the Teenage and Young Adult Service, Cancer Service in Northern Ireland. It means that they're going to be able to have someone there for them all the time and not feel alone. Whereas, before this, a lot of young people were in the middle of nowhere in the rural parts of Northern Ireland and felt very vulnerable and alone. I think most people see cancer as what they see on TV in the adverts. It's old people with lung cancer or women with breast cancer. Teenagers to young adults, you forget that young people can have cancer, and this service is kind of bringing them to the forefront and making sure they're not forgotten, because for a lot of people it's the most important times of their life, and to have the support will help them get through it.
As part of my role, I was asked to identify the gaps in the service delivery in Northern Ireland for teenage and young adults with cancer. My findings highlighted that there was a need for a regional service. It was a very Belfast-centred service, and we were looking to develop a service, and that couldn't be done without the collaborative approach of the 5 national and local charities that are involved today in helping support this launch.
Medically, teenage and young adults will be treated in a very similar way than young children will be. Children rely on their emotional support from their parents and their siblings. The teenage and young adults look out further, and this service is going to provide an on-tap support for them province-wide. It's going to be the whole way around Northern Ireland for patients to be able to pick up a phone and ring someone and say, listen, I have a problem here. These nurses will visit them at home, visit them in the hospital, and the whole plan is to improve the whole quality of life through their cancer journey.
It is very important to provide age-appropriate care for teenagers and young adults. They have specific needs biologically, emotionally, psychologically. They have their peer support, they're going through developmental milestones. They're mostly being treated in adult wards throughout Northern Ireland, so it's really important to highlight their needs, and indeed in NICE guidance, the government have recognised that teenage and young adults should have specific needs addressed while in the hospital setting and indeed in the community.